Welcome back to another episode of Bite Back. Teeth is the easy part. Being a woman in dentistry, now that's where things get interesting.
In today's episode of Bite Back, we'll be talking about the not so glamorous side of dentistry. The part that people don't always see.
Amelia, you've got an interesting story for us.
I do. And you know what's funny? It literally happened like last week.
Like 3 days ago.
So it's like perfect time to bring it up. So I was in Brazil. I think we spoke about this on one of the other episodes. Doing some training in zygoma implants. Amazing experience. Like, I'm so grateful to have been able to go there and do it. But I guess this is the part that people don't see. The hard work, the being literally flying. I was there for 5 days. So I flew from Australia. It was like 28 hours to get there. In another country.
And you don't do well on flights.
I do not do well on flights. I do not do well with the flying. It's just not comfortable. In another country where you're eating, obviously, different food and water. The water, I think I must have drank something that just, I don't know. I honestly don't know. I was really ill. I literally threw up the whole night, had to go to surgery the next day.
You can't miss a day, right?
Oh, no, you've paid so much.
Course.
There is no
There's
way.
no way. Yeah, you can't do it the next day. Yeah.
Nope. You've got 5 days. And I was like, I'm just going to suck it up. Like, that's what had to happen. At the end of the course, you know, Zygomaniac, the boys, CB and Marcelo, they're like, hey, can you just like do a little video for us? I'm thinking, sure, no worries. Did the video, didn't think anything of it. This was months and months ago. Just recently it circled up on Instagram and you messaged me being like, girl boss. I saw the video and I thought, oh my God, that's not what I look like. Like, I look like crap. And I didn't want to repost it. Like, it, honestly, I was like, oh my gosh, this is what people are going to think of me. What are they going to, that's what I look like.
Well,
And
I thought you actually hadn't seen it. That's why I shared it with you, because you often share, you know, if you're in something, you'll share it or you'll repost it or whatever. When it came across on my feed, I was like, oh, damn, like, go girl.
But that's
so
what
I sent
you
it
saw.
to you.
I know, and that's what you saw. But me, I'm like, oh, I look like crap. Like, this, what? I was like, I don't want everyone to see this. But, I mean, you gave me really good advice.
Yeah, no, I think we're our own biggest critics. To me, I was like, she spent all day in surgery. She still looks fab. She's articulating herself so well. Like, these people have chosen her to advertise their course, which is like another, like, it's a big boost in ego as well. So I was like, you know what, she's done so well. I was like, go you. So when you actually wrote back and said, no, I saw it, I didn't want to repost it because I look so terrible, I was like, are you effing kidding me? Like, you look great. Like, do not let that stop you.
Yeah. But this is the part that I guess, you know, we need to just come to reality. Like, it's not always going to be glitz and glam. And I think that's the part that we want to show on Instagram in particular and to everybody, that it's always easy. But in the reality, it's not. Like, think about when you're prepping. You could spend 5-6 hours sometimes doing a full mouth rehab. At the end of it, you're thinking, oh my gosh.
And I walk out with loop marks on my face.
Yeah.
Marks on my face, and like my hair's all over the shop.
Yeah, and drained, like mentally exhausted.
Yeah, 100%.
But that part is not the part that people see or even think that we go through, because we wake up, we show up all the time, bright-eyed, like perky, but...
Yeah. Social media, it's always like you pick and choose what goes on there as well. So it's always like makeup's done, hair's done, whatever. But yeah, day to day, it's probably not, I mean, it's definitely not what it is on Instagram.
Yeah.
Yeah, you definitely don't look like that every day, especially after those long, big cases or dealing with patients that are like difficult as well. You kind of walk out looking like a completely different person.
Yeah, and that's the part that I think, you know, everybody needs to realise and know, that what is on Instagram and social media, it's okay for it not to be perfect. It's okay for us not to be perfect. I think we're always dealing with perfection, especially with teeth, but sometimes it's okay for us not to look like that. So that was really, for me, I think I needed to hear it. And again, we're doing this podcast, so we're at the point where, you know, we're confident in ourselves, and I still felt like that. So that's scary. Like, that was scary for me when I'm like, why do I still care? But we really do. Like, unfortunately.
The question is, did you repost it?
I did. I reposted it with your back. You're like, no, you're doing it. I'm like, okay, I'm going to do it. So I did repost it.
Good.
It's on my Instagram. But yeah.
Yeah, amazing. Go you.
Thank you. With veneers in particular, you know, everyone, back to social media again, before and after. How you've got from A really to Z. Because they didn't see B, C, all the in between. But people just think it's A to B. But there's so much effort that goes in that people don't see? Talk to me about that, because you're the queen of that. So
again, social media shows you one side of things, but when you're actually doing the work, there's a completely different story behind the scenes. So there have been times where I've spent, let's say a case will take me like 2 hours to prep and like an hour or two to insert, right? That's 3 hours. But each case actually takes you like triple the amount of time. There have been times where I've driven to the lab late at night to drop work off because let's say a patient's traveling and the technician needs the impressions or whatever that night to get the job back in time. I've woken up early to go pick lab up as
I remember
well.
one time it was 4 o'clock in the morning, I think, and I saw your message and I was like, what?
Yeah, no, it's like, it's wild. You do what you can to give the patient the result that they need, but also sometimes the times that we have to do it are really tight. And then not to mention all of the hours in between of like communicating with the lab. So there'll be calls, there'll be text messages, there'll be FaceTimes, there'll be back and forth emails. So all of that adds on to that case. People don't see that. Yeah. And that's the non-glamorous side, the extra little stresses or the extra little things that you have to do to make a case work. And it kind of ties back to going like above and beyond, which I think most, like all of the clinicians at Dental Boutique are really good at. I think we do go that extra mile for the patients, and that's where they do appreciate us a little bit more. So when I tell a patient, no, don't worry, like I'll pick it up in the morning before I come to work, I drive an hour to work. Yeah. So driving to the lab is an extra half an hour of driving for me. Or going after work, it's not as simple as just dropping your impressions off. Yep. It's literally sitting there for the next hour, talking about the case, designing it with the technician, and then getting yourself home. So the hours are a lot longer than your 8:30 to 5:30, like, you know, the times that we're in the clinic. So I feel like that's the non-glamorous side for me, the extra hours that you put in.
Yeah, and for us, it's become a norm. This is the thing. And you know, we just go, oh, yeah, we do that. And then sometimes I'll talk to other dentists and, you know, they don't put all that effort that we do at Dental Boutique in. So I do, I like, it's normal for us.
Yeah, I don't think twice about it now. But if the tech is like, can you pick up the lab work tomorrow? I said, yeah, okay, no worries. I'll wake up earlier, drive there, grab it. Yeah. You know, it's like it's just like an everyday thing for us. Yeah.
But that is definitely the non-glamorous side. Yeah. You know, everyone
even our technicians will drop lab work to our houses 100%. Early morning, late at night, just to get things done. So it's not only us doing the hard work behind the scenes, it's the techs as well, which if you don't have that kind of mentality both ways, it doesn't work as well. Yep. So it's quite nice that, you know, if you're trying hard, you've got someone that's working with you that's trying just as hard.
Yes.
So it makes a difference,
But that is definitely the non-glamorous side that people don't see.
Oh, yeah.
They see the before and after.
I'd love to sleep in a little bit longer.
I agree.
I'd love to get home at a reasonable time.
I know.
Yeah.
But that's the
part. And my partner would love it too.
Yeah, I think everyone, I agree. I think that's the part that people say, oh, that's before and after. Like, how hard can that be? It's the hours that we've put in that just do not get seen.
You know, and it makes it so much easier having supportive family members and partners. Like, there's no way I'd feel okay to do any of this if my partner was like, oh, how dare you do that? You're not spending enough time at home or whatever. So having that support behind you actually makes life a lot easier. Same as you. Like, I know your partner went to Brazil with you. Like, that's a huge ask.
Yeah.
Because it's a long way to go.
Because I couldn't travel by myself. Like, I just literally, I got too much anxiety to, like, get on a plane by myself. And he's like, well, I'll come with you. Yeah. And it was like 5-6 days and he was there.
Yeah. So that's like loss of income for him, like time away from whatever he has. I know he does jiu-jitsu or the gym or whatever it is. It's like he breaks up his lifestyle to support you. Yeah. And you would do the same for him.
But we are very, very lucky.
Yeah.
Because I know, like, not everybody understands it. Being married or being with somebody that's a dentist in particular, in our field, like where we are now today, it's hard. And I don't sugarcoat it. I always say to people, if you don't have it takes a village, really. You know, our family members, our partners, like that's the support we get. And we get emotional support from them too. That's a big thing. So I think that if we didn't have them, we didn't have our support network, I don't think we'd be where we are today. I really don't.
No, I don't think so either. Yeah. I genuinely believe that I'm here now because of the support of my partner. Yeah. Not only my partner, my family, my in-laws. Yeah. Like my mother-in-law will cook a couple of meals for us every week and drop it off. Like if we didn't have that, like I wouldn't be going to bed till midnight every night.
I agree.
By the time you make yourself a meal or even like Uber Eats, like, it'd be a mess. Yeah.
I completely agree. And we're very grateful. Obviously, it's taken sacrifice. It takes sacrifice from everybody, right? And that's, again, the non-glamorous side people don't see.
Yeah.
The amount of effort that goes behind all of it.
But the village puts in the effort as well.
Yeah, that's what I'm saying. Like, it literally takes a village.
Yeah.
You know, they say it takes a village to raise a child. It takes a village to be where we are. So I know that, like, it's a lot. It's for a lot of the females in dentistry, that's somebody along the way has had to sacrifice for them. Thanks for tuning in to the podcast today. We can't wait to have you back next time. Please leave your comments below and any questions that you have. It was really nice talking about the non-glamorous side of dentistry, and I know a lot of people want to hear that side of things. I mean, both Dr. Jelena and I have our own stories and experiences, but we are very grateful that we do have our village that keeps us motivated and has gotten us where we are today.
As always, scrubs on, doubts off. We'll see you in the next episode.